Clinical integrity. What does this mean to you? Is it the same as academic integrity? Give some thought to what is clinical integrity. What are some of the factors that might belong in clinical integrity? You know what academic integrity is. Certainly that's to be honest, not to cheat, earn your grades on your own through good preparation. But what is clinical integrity? Isn't this what the patient deserves? So let's look at some things that might belong under clinical integrity. Being familiar with the clinical standards and scope of practice for diagnostic medical sonography. These can be found on the Professional Society website. These were revised in 2014-15, so they are current. They provide the roles, responsibilities, and expectations. It is a go-to document in the event of legal lawsuits. Are you practicing within the scope of practice, or are you not? Work ethics. Do you arrive on time to work? Do you put in your full shift? Are you on your cell phone? Are you doing something else, such as Facebook, on the computer, or using the hospital internet service for something that is not work-related whatsoever? Are you bringing home some supplies from the hospital, for example? That's called theft. Are you being honest to yourself? Do you have the appropriate certifications? Are you registered in abdomen and OBGYN and breast if they're the exams you're doing? Are you preparing for the RVT exam if you're doing vascular exams? That's clinical integrity. You are giving your best education and knowledge to perform the exam for that patient. What about record keeping? Some places have log sheets for infection control while cleaning endocavitary. Are you doing them honestly or just writing numbers in? Maybe refrigerator temperatures. Doing them as you're supposed to daily, or at the end of the month we'll fill in some numbers. Attendance. Are you abiding by the time clock policies? Compliance. If you're aware of a HIPAA violation, are you reporting it? Are you guilty of HIPAA violations? Education modules as an employee, you have to do them annually. Are you doing them honestly, or are you giving somebody else your password and they're going to do them for you? So these are things that I've experienced along the way. And again, I'm not perfect. Those education modules, I will not give my password. I will do them. I won't say I always read every slide and every page. Sometimes I go to the end of the test quicker than I should. But we recognize what it takes to be a good healthcare professional who wants a career. What's your professional behavior in and outside of the work environment? Are you going to work a little hungover? So again, I'm not trying to paint a negative or bad picture. I'm just raising the question. Because to protect yourself from lawsuits, you need to be honest. To protect yourself from being disciplined or fired, you need to be on time. That's why the program has strict tardiness policies. Employers have strict tardiness and absenteeism policies. So why not learn the habits while you're in the program? Occasionally, it happens to all of us. Being late consistently is not the occasional. Modify the behavior that's causing you to be late. Leave earlier. Prepare the night before. Whatever is causing that, you need to find alternate ways so that you come into compliance. And that's so true of clinic. Every day you walk into that clinic setting is like being on a job interview. And so make a good impression. Don't be so overly helpful that you're getting on their nerves, but don't be the wallflower. So find the happy medium. In healthcare, it is based on integrity, honesty, and compassion. This is why we as sonographers must understand patient behaviors, patient interactions, and the standards of conduct, in addition to developing our technical knowledge and skill. Have the right balance of confidence. You don't want to be overconfident by saying, oh, I already know how to do that. But you don't want to be underconfident and need somebody to hold your hand the entire time. Know what your limitations are. Express to your clinical instructors, you know, I need more experience in obtaining the abdominal aorta bifurcation. Or the liver is a big organ. It can be confusing. Share with them and they will help you. And then improve upon the limitations. But don't refuse to scan something because you already have a competency performed in that and you don't need that one. Scan every patient you're given the opportunity to. You will always find areas and learn a new skill from someone. So academic integrity, what does this mean? What are your thoughts? What do you think happens when you violate this policy within the university? And then the question is the shortcut really worth it? Is the short-term satisfier with long-term consequences? Be honest. Everything is cumulative in this program. Taking the shortcuts, I guarantee, will result in either not completing the program or not passing boards. And most of the time, a shortcut in the academic arena is also a shortcut in the clinical. And people are very observant to that. Be honest. Ask for help when you need it. Do not take the shortcuts. You're investing dollars into this program. Your faculty and clinical instructors are investing a lot of time and their expertise. Respect it. We have different ways of doing things. You certainly can question, but you don't want to say to someone, but Karen told me this, or Maria told me to do it this way. We all have different ways. If you need something for that particular course, then go to the course instructor and clarify. But don't tell another instructor or, have a perception that you're talking back. Say thank you. Are there other ways of doing this? I've seen it done this way. What's the difference? You can question it, but not say, well, why do I have to do it this way? Because, Karen doesn't do it this way, so I don't want to do it that way. No, you're going to find in the clinical setting that everyone does things differently. So learn from it. In the academic, we teach differently. Our notes are differently. But in life, nothing is ever constantly the same. So we learn in multitudes of ways. And you learn in multitudes. That's why we integrate multiple types of activities. And so through those activities, you want to be able to be honest with yourself. And so misericordia policy, and you'll want to refer to our handbook for the policies on academic integrity or any behavior. So think about integrity. Think about professionalism. Professionalism isn't only the communication piece. It's about appearance. It's about what's on your social media page. It's about, your nonverbal. It's about your willingness to say yes to something. Maybe they need the garbage taken out. Say yes. It's, you don't want to respond with, it's not my job. Get your certifications at the end. Do well in your coursework. Research a pathology when you find something in clinic. You will learn and apply from the clinical setting. So hopefully you are choosing a career and being professional within it, showing your integrity.